Okay, picture this. A young woman walks into your clinic. She just got back from what was supposed to be a fun, sunny vacation. But instead of being all relaxed and refreshed, she feels completely wiped out. She tells you about this nagging, deep joint pain, and then she points to this weird, butterfly-shaped rash that's popped up right across her cheeks. Now, her story is one of those classic medical puzzles, right? You've got these symptoms that seem kind of vague on their own. I mean, fatigue, achy joints, a rash. But when you start putting them all together, well, they begin to paint a very, very specific picture. So, what in the world could possibly connect all those dots? That's exactly what we're about to break down. Salam and welcome to A Little Push, your 5-minute guide to medical mnemonics that actually stick. Today, we're diving into one of the biggest puzzles in rheumatology. The condition we're zeroing in on is systemic lupus erythematosus, or SLE for short. You know, it's a real master of disguise, this disease. It can affect almost any part of the body, so to tackle it, you absolutely need a clear, systematic way to connect all the clues. And the key to that system? It's this awesome mnemonic that brings a little order to all the chaos. To get a grip on SLE, all you have to remember is Brain Soap MD. It's kind of brilliant, because this one little phrase holds all 11 of the official diagnostic criteria. And here is the golden rule. This is so high yield for your exams and, more importantly, for real-life practice. To make a definitive diagnosis of SLE, a patient has to meet at least 4 of these 11 criteria. Got it? 4 out of 11. Let's lock that number in our heads right now. All right, let's roll up our sleeves and really unpack this thing. We're going to start with the first part, brain soap, and go letter by letter to make sure it all makes perfect sense. So first up, B is for blood dyscrasias. It sounds complicated, but really, it just means that lupus can mess with all the different cells in the blood. So you might see things like hemolytic anemia, where red blood cells are destroyed, or leukopenia, which is low white blood cells, or lymphopenia, specifically low lymphocytes, or even thrombocytopenia, a drop in your platelets. R stands for renal disorder. Okay, this one is a really, really big deal. Lupus nephritis can be incredibly serious, and it often determines how a patient will do long-term. What we look for are clues like persistent protein in the urine or finding these things called cellular casts. It's so serious, in fact, that a kidney biopsy is often needed to see just how much damage has been done. Our first A stands for arthritis. But, and you gotta catch this, it's a very specific kind. It's non-erosive arthritis. What does that mean? It means you get the pain, the swelling, the tenderness in 2 or more joints, but you don't get that destructive bone damage you might see in something like rheumatoid arthritis. That is a super important distinction. I is for immunologic disorder. This gets to the very heart of what lupus is all about. It's an autoimmune disease, right? So here we're looking for the troublemakers, the specific antibodies causing all the inflammation. The 2 that are basically the smoking guns for lupus are anti-double-stranded DNA and anti-Smith antibodies. If you see those, you're thinking lupus for sure. N is for neurologic disorder. Yep, lupus can get into the central nervous system, and when it does, it can be pretty dramatic. The 2 big red flags that count for this criterion are unexplained seizures or the sudden onset of psychosis. S is for serositis. The easiest way to think about this is inflammation of the slick, shiny sacs that surround our organs. For lupus, this usually means pleuritis, inflammation around the lungs, or pericarditis, which is inflammation around the heart. And both of these can cause that sharp chest pain that gets worse when you breathe in. O is for oral ulcers. Now, here's the tricky part about these. They are almost always painless. A patient might not even have a clue they're there. That's why you have to do a really good mouth exam. They're often hiding up on the hard palate, which is why it says they need to be observed by a physician. And our second A is for anti-nuclear antibody, or ANA. This test is a huge deal in rheumatology. It is an incredibly sensitive screening test, which means it's positive in pretty much every single person with lupus. But, and this is a big but, it's not very specific. Plenty of perfectly healthy people can have a positive ANA too. And P, the last letter in brain soap, is for photosensitivity. And we're not just talking about getting a little sunburned here. This is an over-the-top, abnormal skin rash that erupts after being in the sun. And hey, this takes us right back to our patient at the very beginning, doesn't it? The one who just came back from that sunny vacation. Okay, so we've scrubbed up with brain soap. Now it's time to call in the MD to finish this thing off. These last 2 criteria are all about the skin, and they are classic textbook findings. M is for the famous Malar rash. You've probably heard of it as the butterfly rash. It's that fixed red rash that spreads across the cheeks and over the bridge of the nose. But here's the pro tip, the diagnostic key you have to remember. It almost always spares the nasolabial folds, those lines that run from your nose to the corners of your mouth. And finally, D is for discoid rash. Now, don't mix this one up with the Malar rash. Discoid rashes are a whole different beast. They're these distinct, red, raised patches that are kind of scaly. You can find them on the face, the scalp, the ears, and the really crucial thing here is that they can cause permanent scarring and hair loss. Okay, you have officially mastered the 11 criteria. So now I'm going to let you in on a little clinical secret. This is a classic board exam favorite, a little pearl that connects immunology with a totally different field. You are definitely going to want to file this one away. Here it is. Patients with lupus can have a false positive test for syphilis. So why does that happen? Well, it's basically a case of mistaken identity. Some lupus patients make these things called anti-cardiolipin antibodies. And it just so happens that the common screening test for syphilis, the VDRL at RPR, use an antigen made of cardiolipin. So the patient's lupus antibodies see that antigen, they cross-react, and boom, you get a false positive. As we wrap up, it's so easy to get lost in all the criteria and antibodies and the science of it all. But it's good to remember what this is all about. It makes me think of this quote from Voltaire. The art of medicine consists of amusing the patient while nature cures the disease. Now, of course, we can do a lot more than just amuse them these days, but we should never, ever forget the art of just caring for the person right in front of us. And that is our deep dive into the Brain Soap MD Mnemonic for SLE. I really hope that helped clear things up. Keep pushing, you're doing great. Until next time, salam.